Thank you. Dr. Cope, I'll turn it over to you.
All right, good morning. Sorry, just trying to turn off my phone ringer there so I can share screen. All right, well, good morning, everyone. First, I want to say real quickly that I have not had time to do the more in-depth data analysis of our most recent cases from yesterday. So this presentation won't include all of the data that I usually like to include and kind of the breakdown of the ages and types of exposures. And I will try to get that data analysis done by the end of today or tomorrow and get that posted on the STIC website. But today's presentation will just have some more basic data. So right now we've got 18 active cases in Mia Bay. We have had 82 cases total. 29 households are in quarantine. So the vaccine data, we haven't gotten that data updated yet since September 10th. So there's more than this, but right now 76% of our population 12 and up is fully vaccinated. At least there's probably more that's happened since September 10th, and our staff is working on getting those numbers updated. So, and 83.2% of our 12 and ups are partially vaccinated. This slide just takes a look at where we're looking for September projections. Today's September 20th. So as the month has gone by, things have overall calmed down from where they were the last week of August and the first week of September. I know that's hard to believe given the increase of cases just yesterday and on Thursday last week. But truly, we are in a better position than we were going into the shelter in place on September 3rd. So that is certainly encouraging. However, we are certainly concerned about the amount of COVID positives and mostly concerned about the amount of households that have ended up in quarantine. So what that tells us is that even before shelter in place was lifted, is that there was a number of socializing happening. Household groups were not allowable during shelter in place, and well, they were only allowed in instances where caregiving was required or someone lived entirely alone and could join one other household. Clearly that was not being followed. So that's certainly the thing that's most concerning in that shelter in place was in effect and that was not happening. So that certainly has contributed to why so many people are in quarantine at this time. I want to talk a little bit about the vaccines. As many of you know, the booster dose for the general public was ultimately not authorized. It was recommended for healthcare workers. Sorry, this slide got a little bit messed up. I can see this is supposed to be a second bullet. And looks like this is the draft version. My apologies. So it was recommended for those 65 and up and with moderate or severe immune compromised state, which is ultimately at the discretion of the provider. And it was, I want to be very clear that it wasn't authorized. It wasn't not authorized because it wasn't safe. It was just deemed as not being necessary. So that doesn't, there was not any concern about the safety. There was a concern about focusing on booster doses when really the focus needs to be on those people who are completely unvaccinated, because so far the vaccine has been effective for increasing the likelihood of surviving COVID and not having severe illness. Certainly people who have been vaccinated have passed away. That's well known and documented. And so what we're trying to do is reduce the chance of that as much as possible, and the vaccine does do that. Clallam County continues to be at a sustained level of high risk. In fact, all of Washington, Idaho, and Oregon are at this, but Clallam County is certainly one of the higher risk counties. Percent positive has been between 19 and 21 for multiple weeks now. They are seeing an increase, a little bit of a bump in increase in vaccinated patients getting COVID. We had 6 deaths since last Friday in Clallam County, which is certainly concerning. And the rate per 100,000 over the last 14 days is 1,108. The highest it's been was 1,300 a couple of days last week, I believe in the end of the week before. So that is starting to maybe come down, but really I think we're at a sustained high risk level at this point. This is just a graph showing that rate of new cases per 100K. Could look like it's peaked and coming down, but what is right now predicted is that the peak comes within the next 2 weeks or so. So it's not believed to have peaked yet. Clallam County hospitals are still full. That doesn't mean they're turning around patients, but it does mean there is a delay in care, and when possible, transfer to other hospitals that is sometimes hard to find. And I do want to talk on this slide a little bit. I don't have a slide on it. You may have heard in the news about crisis standards of care, which is, that's what happens when there is a healthcare need that outpaces the availability of healthcare, whether that be staff or medical supplies, beds, et cetera. So when that gets to a critical threshold, hospitals and sometimes states, counties, different jurisdictions will enter into a status, it's a legal status called crisis standards of care. And there are algorithms that when a patient, when a doctor or a team, a medical team has to choose between providing, for example, an incubator, not an incubator, sorry. Why am I spacing on the word? A ventilator. Thank you. When there's, let's say there's only 1 ventilator and there's 2 patients or maybe 5 patients that need it, the medical team, and oftentimes there's a medical ethicist who specializes in ethics, helps the team go through an algorithm where they have to decide who gets the ventilator and who doesn't. And that is certainly very traumatizing for the team and families. And it's, anytime we're in that situation is certainly very concerning. So we are not in crisis standards of care. Clallam County is not in crisis standards of care, but there is certainly a delay. So if you need medical services for other reasons, it's just going to take a while to be seen. This is the Washington State data. I didn't get a chance to update this slide or this one. This just shows that this is happening certainly around the whole country, and that, like I mentioned, Washington and the Northwest continues to be a sustained hotspot. This I did get a chance to update. You can see the rate of new cases is, as I mentioned, sustained. That's the top chart there. The deaths, there's been an increase in like 20% increase in the rate of new deaths. Hospitalizations in the middle graph on the bottom, that has actually started to decrease. So and I'm sure epidemiologists are starting to think there might be either this is just a plateau or possibly the start of even a second bump within this wave without even having gone down to baseline. So what we see is typically there's a 2-week lag between new cases, hospitalizations, and then 2 more weeks we start to see the deaths. And that's what we're seeing right now. And then certainly concerning is that rate of new cases starting to increase again. This is a weekly report we get from Washington State showing the variants that are coming through. That orange is all Delta variant. So that is certainly a majority of all the cases that we are likely seeing. Not every positive case gets sent out for genomic sequencing because it's truly assumed once the Delta variant has taken place in a community that most of the cases in that community are Delta, which is clear there. I wanted to talk a little bit about this disaster response cycle, and I did see that our behavioral health clinical supervisor, Betty, is on the line. Betty, are you able to talk a little bit today, or did you want to were you just watching?
Oh, here I am.
Great.
Sorry. Oh, there I am. Sorry. Zoom is a struggle to do the work that we do. So talking to gray boxes is an increased struggle. So I encourage anybody that wants to put their face on it, be awesome. As far as it goes for behavioral health, I was asked to talk about stress in 3 minutes or less. That's just stressful in itself. With what's gone on in the community in the last week to week and a half with the recent deaths and tragedies, behavioral health has already put together we call it a guide to loss and grief. Loss and grief does not just mean to death. It can mean change of job. It can mean change of your own health standards. It can mean change in whether you go to work in an office or whether you have to Zoom from home, whether you're able to see people face to face, whether you are not able to do that. The kids and I term it the yo-yo effect. It's up, it's down. We never know really how we can control it because you can't control it. And I think just the word control or lack of control adds to stress level. When we feel in control of our lives, of what's going on around us, there's a balance to us, a natural balance. When we don't feel in control, when we're not sure what will come the next day, there is a sense of fear of the unknown. What will tomorrow bring? And so, trying to normalize our lives as much as possible within a very abnormal situation that is uncontrolled, that is difficult to control, is trying to be controlled. It's been many, many years since this kind of impact across the world has happened. And so some of it is learning from the past, some of it is learning as we go. We put together a guide, and I'll be sending it out once it's finalized to Libby to put it on stick. We'll also be sending out to Makah all. And I went to the school yesterday and spent some time with the senior class, just being there with them. I think the night before they did their own way of honoring. And I think that was because it was driven by them, I think it was much more effective. We often have to, as adults, we think we can help. We want to help. There's nothing wrong with wanting, but we often forget to ask what is helpful. So I did put together a one-page write-up on grief and what it might look like. And everybody's process is different. Their clock is different, and that should be respected. I look at things through nature's eyes. So mine was through seasons of grief. And all of the school got it, all the seniors got it, all the educators got it. I'm more than willing to share it with anybody who would like a copy. I will not be putting anything on Facebook. That is my own control of stress. And what can you do to control your stress? Well, you got to normalize your own life. You've got to make sure, first and foremost, especially if you're parenting children or caring for others, and that is a huge component of the Makah culture, is that you are taking care of yourself. And so getting enough sleep, eating a healthy diet, getting exercise in any way you can. We live in a beautiful area. The weather has not been that bad. It's graced us this summer. Some days a little heavier than others, but to get out and just get the natural beauty and and air is another way. Because we often can't reach out to those in other households, then, you know, I was never a technology girl. I was anti-Zoom, anti-anything behavioral health wise on a computer, and I've had to adjust. And so I do a lot of Zoom with family. It keeps us connected because it's very difficult to do any kind of travel and keep everybody safe. So I never like to just be the one to talk. I find that to be more lecture style, and I don't learn or absorb things very well that way. So I would like to open this up for any questions.
Sure, I think that's,
Okay.
yeah, I think that's wonderful. Thank you so much for being on
Behavioral
here.
health can be contacted just because, look, it's the nature of our business. We always have a wait list. But don't stop and not put yourself on the wait list, because the wait list always changes. So anybody can be reached at the Wellness Center 645-2075, or you can call me directly at 645-3266. Okay. Sure.
Great. I just put your phone number in the chat. Thank you so much, Betty. And then the Wellness Center, I think most people know, 645-2075. We also have some phone numbers on our website for after hours, and certainly want to make sure that it's covered as well. So thank you so much, Betty. I appreciate your providing support to the students and families and the schools, and for so many years. Yeah, the after hours. So I'll try to get the after hours phone number typed in there, or if someone else, if I have another staff member on this call, can
I will go get that right now.
Perfect. Thank you, Betty. That would help out a lot. Thank you. Great. So the chart in front of you, all of what is certainly currently happening locally is happening in the context of this larger disaster response. So on the chart below, it shows the months pre and post COVID outbreak. So we're here in September. Initially was the impact, and then and just to be very clear, this is a disaster chart that is used for all disasters. And so it's just being applied to the COVID-19 pandemic. But this is very, what is expected and has been observed is this initial heroic effort and a honeymoon phase as the community comes together. And then there's a disillusionment. And then what's happening now is a secondary impact. Obviously, things are happening this year that really our worst case scenario that we anticipated might happen last year. Now we're having, that's actually happening, the things that we were certainly most concerned about and preparing for last year. And now, depending on protective factors, we're watching members of the community have different experiences of this possible honeymoon and disillusionment. Most people that we're observing here and actually elsewhere are in this disillusionment phase. So just to be mindful of it, certainly mental health and behavioral health risks are community-wide extremely high. And all that means is if there's ever been a better time to do the things that Betty was mentioning that we all know help our selves maintain control and staying grounded, going for a walk, connecting with loved ones in ways that feel good and are safe, and drinking water, getting enough sleep, really prioritizing when it's time to go to bed, and as much as possible, those things that we have control over to do. So thank you again, Betty. I really appreciate you jumping on last minute.
So that I just sent out the crisis hotline, the VOA. That is everyone who answers the phone is a licensed mental health counselor. And that's
Awesome.
something that changed in the last year. So.
Great. Awesome. Thank you so much, Betty.
Mhm.
The phone number is also on our stick.org website. We'll make it a lot bigger. So we'll try to do some website rearrangements there. But please, everyone on this call, don't hesitate to get that number, share it, make sure it's written down and somewhere accessible. Yeah, thank you for doing that and reaching out to your loved ones as well to make sure they have that access. Okay, this is a repeat slide, just a reminder about the preventive and proactive. These are always going to be more effective than the reactive responses to COVID. So it's certainly more effective to get vaccinated, follow these health orders, keep your social circle small. That's what we really, I think, are struggling with, is keeping that social circle small and wearing those masks when you have to be around others. And then the reactive, of course, here we are doing the best we can with the case and context tracing and keeping people in quarantine. And then monoclonal antibody treatment, we do have it here in Nia Bay. We've got our blue trailers all set up to provide monoclonal antibody treatment. And we are working closely with the state to make sure there's a set aside for Makah for any allocations or distribution of it. But we do have it here. We are not out of it, and we are using it when we need to. And this is just another reminder slide as well. So every single one of these interventions alone is not effective and not going to prevent the transmission of COVID, but together they are going to be pretty strong and preventive. And just another plead on my end, please get vaccinated. I don't think I mentioned it, but the authorization for 5 to 11-year-olds is anticipated to come out pretty soon. And I hope that our community, just based on the initial response to the vaccine, that could alone get us really close to quote unquote herd immunity or community immunity. So I'm really hoping that happens, but certainly no guarantees on the timeline for that. But when it's ready, and if you haven't been vaccinated yet, please do get vaccinated. It's not 100% guarantee that you won't get COVID, but it does help a lot. And in combination with keeping our social circle small and not traveling, especially in an airplane, and wearing those masks, all three of those things are completely preventative for keeping COVID from an outbreak in our community. All right, so with that, I will stop for any questions specifically for me.
Hi, Libby, this is Maureen.
Hi, Maureen.
Will this PowerPoint be available for future reference?
Yeah, the EOC meetings are, these public briefings are recorded and then posted on our website every Tuesday. So by 5 o'clock today, it'll be up on our website, and then those are archived. And then we do another informational update on Fridays.
Okay, thank you. Because some of this stuff I can take and print and possibly put in our deliveries and get it out to the elders as well. So
Great. Awesome. Thank you for sharing. Any other questions?
Do we have any other questions for Dr. Cope?
Yeah, Dr. Cope.
Hi. Hi, Treasurer Bochop.
Yeah, thanks. This is Chad. I missed the very front end of this. Did we, because yesterday was pretty concerning with the new additional cases, through our close contact tracing, have we determined, are there any new cases today?
No new cases as of today. We're going to have our testing again. We're having it at the community hall again today because we do have a number of people who've called for appointments. I can't say, but I would predict that there will likely be at least a handful of new cases, but I don't know for sure.
Yeah, that was very concerning to me, and I'm encouraged to see the percentage rate of our vaccinated people continues to rise. So that's very, very encouraging to me, and I appreciate the good outreach work that you folks have done. And we all are going through this COVID exhaustion, so that's maybe the honeymoon term or phrase might be too, maybe a little too, I don't know, casual. But to me, this variant spreads like wildfire, and we all know that. And that's what's very concerning to me, especially if our attention to these preventative strategies, starts to ease up a little bit, then we just invite that variant to run us over. And the challenge is we did the first round well enough that, we kept up and the results were good. We could see, that we were equipped to address that first round of COVID. In my personal opinion, the second round of COVID, we're addressing it with the same level of capacity, and we're really close to being, over capacity. We're really close to being run over in a number of areas, from our clinic staff to our public health to our operations, just across the board. We're very close to being right on that razor's edge. So I do appreciate, and I'm very concerned about this recent surge that we're experiencing. So hats off to everybody who's working so hard. Thank you very much.
Thank you, Councilman Bochop. I do see somebody has a question. They have their hand up. Not sure of your name though. L. Anderson.
Good morning. This is Laveda Anderson over at the Veterans. I just was wondering how you feel about, Dr. Cope, the Illume, the COVID-19 home tests, the rapid tests.
Yeah, I mean, any testing is good. Certainly any home testing is, I just want to make sure that when somebody does test, that they ideally report it out to us so that we can help them with any sort of medical concerns or isolation and quarantine. But yeah, testing is good. And I meant to say that in my presentation. I'm just so thankful that the community has showed up to get tested. That, even though it's scary to get all these notifications of positive cases, better than not knowing. So my understanding is that the Illume test is authorized for use, and I recommend, and a positive at home is for sure a positive. So if somebody comes in and they've got a positive home test, and then for some reason the test, it's not detected with our tests here or with the PCR test, it's still considered a positive. So they would have to continue to isolate and quarantine.
Libya, this is Maureen again. So when those people when you do your contact tracing, and those people that have been contacted are not able to get to the testing site, will you guys go to their home and test them?
Absolutely. Yeah. In fact, we do that a lot.
Okay, because we didn't know that, and I don't think a lot of the community is aware of that. So that might be something that maybe we could add into the newsletter.
Sure. Yeah. I think certainly our nurses, we can add that into the newsletter. That's a good idea. And then hopefully they're communicating with those people in quarantine to let them know that they'll come test them. But sure, absolutely. And we do that. We just recently got 2 new vans, especially with the weather coming up, so that our staff will have a stand-up area that they can test in.
And do they contact the clinic directly if that's the case, if they do need to be tested at home?
Yes, they can do that directly. Just contact the clinic and then we'll connect them to our community health staff.
Okay, thank you.
Great, good point. Thank you.
No other questions? Just a few bits of information here. Yesterday, the tribal organization did return to work. We did find that we had some phone issues out here at the tribal center, but those have been resolved now. The processing of the business applications is on hold for a few days. Today, we are sending out some, excuse me, relief payments to the artists that were provided assistance in 2020. For your information, the October 5th power outage that PUD scheduled, they had to cancel that, and they're going to give us a rescheduled date as soon as they get that figured out. I'd like to thank Betty for what you provided us today. It was very good to hear that that help is available. Also, thanks to Dr. Cope for her presentation. If you know of anybody that hasn't signed up for the regroup, I would encourage you to do that. It's an effective way of getting information. You can also go to the STIC website or the portal and get information there as well. If we have no other questions, we'll go ahead and close today's meeting. There's some information from Libby in the chat.
Yeah, I just put the link. It's on the stick.org website under emergency preparedness, but that's the link if you want to sign up for the mass texting that goes out. So just sharing that.
Okay. Thank you, everybody.
Thank you, Penny.
Thanks, everyone.